The important characteristics of fibromyalgia are that this is a multifactorial pain disorder with very few physical findings. The old criteria for fibromyalgia included tender points, which was the physical findings. The new criteria have removed the tender points from the classification, and so making it more difficult for the provider to identify individuals. Fibromyalgia has become a disorder of self-report compared to a disorder associated with objective findings, which makes it challenging for providers to separate individuals with fibromyalgia from disorders that are associated with muscle disease, joint disease, neurological disease, and so on. The overwhelming evidence shows that the tissue of origin for nociceptive signaling in fibromyalgia, and probably in most musculoskeletal pain disorders, is the deep tissue. And our focus, and the focus of many other groups, has been muscles. And it appears that muscles have the capacity to sense pain, and the transmission of this signals to the spinal cord as well as the brain then is important. It's actually extremely important for this particular disorders, and which also emphasizes that the disruption of this pathway, or even to obliterate this pathway, is a potential treatment strategy. The important and really validated treatment strategies in fibromyalgia have been non-pharmacological therapies in particular, which include physical therapy, which has the strongest evidence for efficacy, as well as cognitive behavioral therapies and behavioral modifications in general. The secondary therapies are pharmacological therapies, because the effectiveness in larger population studies have not been very impressive. However, there are patient groups who respond, and one of the targets of current research is to identify treatment responders, endophenotypes that are associated with treatment response, and then focus in particular treatments towards the specific and personal pattern that these patients have. Oh yes, there's good reason to believe that we're making progress in identifying the mechanism, in particular the central nervous system mechanisms. We have worked on spinal cord mechanisms for the last decade at least, and if any of these mechanisms can be modified either with pharmacological or non-pharmacological therapies, this would definitely improve the pain and the suffering of these individuals, and hopefully to a large degree.